about what the innovations that would happen over the next 5 years and in 2024. So we'll start with you. Where do you, so one is with your company in Fuji, where do you see yourself 5 years from now? What are the most exciting innovations that you're currently working on? But also in the industry, and you are an active participant in the industry, where do you see this industry 5 years from now? And again, more from a tech innovation point of view.
Yeah, thanks, Dr. Bhavin. So first of all, thank you, Express Healthcare, for giving us the chance. And from Fujifilm point of view, what we are looking to transform ourselves as a solution provider company. And early detection is the key to success, what we have taken as a slogan. And we are going to do a lot of screening programs, whether it is the early detection of the breast cancer, early detection of the colon cancer, early detection of lung cancer, early detection of TB. These are the 4 major areas. And we are correlating our products to these areas, whether pathology products, radiology products, imaging products. So what we are doing is that...
So just to understand, less hardware, more software and apps.
Yeah, it's a combination of both hardware and software. But mainly we are going to transform ourselves into IT company with complete focus on artificial intelligence, which can provide the answers to the radiologists and public at large. Because you know that only 10,000 radiologists in India, and worldwide also the situation is not that good. And we have 130 crore people to scan. So if you want to screen for the TB, if you want to screen for any of the anomalies, any cancers, breast cancer, or these kind of things, you require so many scans to be read. But once the AI will give you the kind of solution that these are the normal scans, you need not to worry about them. Only the abnormal scans you can see and you can give the answers for that. That will help you.
Do you see all companies going in the same direction?
Fujifilm is investing hugely in that, and that we are a lot of people, time, and R&D efforts, the supercomputers, the people. We are putting a lot of money into this area. We are betting heavily on that, and we are going to come up with very good solutions shortly.
Well, with Philips, we have always, put ourselves in the shoes of our customers. We have tried to be co-partners with our fraternity and then build solutions around it. As we evolve, we are looking at technology and of course bringing up multiple products and solutions which we have also brought in past, specifically for the Indian market. But at the same time, we are also giving a lot of emphasis on solutions. Not only solutions where diagnosis, accurate diagnosis, patient-centric care is emphasized, but also solutions where we co-partner with customers and help them grow, identifying what kind of infrastructure they would need, financing that would need. So it's really a partnership of equals there, and that's where the focus is. Irrespective, we have brought a lot of technologies in the last 2-3 years. From helium-free MRs, which is lightweight, and faster scanning, and again, patient experience has always been in the core of things. But at the same time, solutions and partnership there is our focus henceforth.
So like an integrated
yes.
company 5 years
yes.
from now.
So anything that they would require, Philips should have solutions to those.
Switch track to Uday. Where do you think you are in touch with all the vendors, right? You work with DM Aster, which is a big chain of radiology and hospitals and departments, and you know everything that's happening currently. So where do you see what are for you the big innovations that are changing and are going to make a difference, and you think the vendor companies need to be in?
So let's look at it from near time and a far term. Something which will come in very quickly is going to be a huge amount of automation for routine tasks. Things that we do it right, we don't do it right. Oh, I don't have a trained person who can do this. Let's take this off and give out reproducibility in imaging. It can extend from giving me that perfect X-ray minus the error to that perfect imaging plane to that perfect reconstruction. And whether I use AI or I use what, none of my business really. And something you do with AI does not make it better, it only makes it easier and quicker to get it out.
So that big bang innovation that we are that's going to happen. What will 5 years from now? What happens? What are we going to be working with? Where do we see ourselves?
So did you read the recent one that Rankin wrote?
Sorry.
Did you read the recent one that Rankin wrote on MRI?
No.
He said after 30 years of getting into MRI, I'm still doing the something. Nothing new has happened. We are quicker, we are faster, we have better images. You know, what was new? We always knew it. So what we are going to get is a huge amount of small thing at multiple places, which will raise everything. Everything in terms of cost of ownership, more productivity per equipment is one side. Better scheduling, find out where my gaps are, analytics. Can I do it more quickly? How can I waste more time? How can I utilize my manpower to the max? Finally, take up profits, do better imaging, and hence better diagnosis, assisted by what I don't want to see. No need for me to see, so let me not waste time. But use myself instead of doing that daily drudgery to where I, the radiologist, can actually spend time in providing value and guide outcomes.
So you're
All
saying
of it.
it's all going to be about outcomes and
It
clinical.
always was about outcomes.
So one thing that's happened over the last so many years, I mean, I think Harsh is not around, but you know, when we started practice, at least I started in 94, 95, every 4 years we would change machines. The pace of innovation was astounding. You went to the RSNA and there was a paradigm shift every 2 years. You went from, you know, regular CTs to spiral CTs to dual, I mean, you know, your 64 slides and the dual energy and the MRs were exploding. So much happening. And today, when you go to the RSNA or any of the tech meetings, as he said, as Uday said, your changes are so incremental. Of course, they're still made out into very big things, but you have a 3 Tesla and then you added compressed sense. I'm sorry to use that term, but you know, it's not a paradigm changing innovation. It improves your speed by 30-40%, and that's a great thing. Or you have one extra diffusion sequence, or your CT scanner has gone from 128 to 256, big deal. You know, that kind of stuff is happening. So, Sushant, is that, do we see hardware advances having slowed down? Is it now all about applications? Is that where we are?
Absolutely. I think we've also realized, I think I come with you and I fully agree with you, and my organization also believes in something like that. I think the potential disruption in the healthcare is going to be more in the workflow, automation, using artificial intelligence, deep learning and everything. Incremental improvements is what we are going away from. And I think that's what the need of the hour is. It's like Uberization of healthcare. What is Uberization? Uberization, according to me, is effectively utilization of an asset. And I think that's where we also see in India. We see overutilization of an asset and we do completely underutilization of the asset. And I think that's where we are trying to focus on a platform which basically utilizes all the, and we are pivoting that idea from an India perspective. And for India perspective, in terms of innovation, that's what I want to say. If I could talk about innovator dilemma here, is that India is the lowest price country because we spend 4% of total GDP, US is 17%.
Sorry, it's 1.5%.
Well, 4% of the total healthcare. The government is only 2.5, 1.5 right now, going to 2.5. 17%.
I'm sorry, it's still less than
It's crazy, right? So obviously, it is going to be an out-of-pocket market, right? In the US, the healthcare model is slightly different. Who owns the money and who spends, actually nobody knows. Actually, it's indirectly you. But the point is, that will always remain the biggest market for innovators. We Indians will be basically trying to adapt to those American products and solutions. So where India comes into picture, it's an exciting market. We have to make, for an innovator, India is an exciting market. And when I go to US, and you have to look at from our perspective too, where is the margins? For example, India is the lowest, I don't know, Fuji can have a better margin than me, but ours is like the lowest across the world. So now obviously you have to push the organization to invest for India, and that's where the dilemma comes in. Where is the money? And we start to push more and more on workflow solutions because it's very clearly India is going to be a fragmented market. So there is an opportunity of kind of mirroring the consolidation, right? And that's what we want to really work on. And that's what I said, that our focus is now a platform on Uberization of healthcare. I think somewhere there.
All these buzzwords that I brought up, artificial intelligence, robotics, augmented reality, 7 Tesla MRIs, we're saying none of that matters anymore because everything that we do needs to be more in terms of just solutions, workflow optimization, being able to answer the clinical question in the best possible way. But the big whiz things are not the most exciting things. Is that the message, Vidur? Yeah, I was about to come to you. Where do you see? You're not a radiologist, yet you work in radiology, you are high-tech artificial intelligence, you've got a Lancet paper, which I don't think any other person in this audience has. Talk to us. Well, you work together, it's a co-authored paper. So Vidu is doing the AI panel, which is going to happen tomorrow. But let's get a perspective.
So I would like to illustrate my thoughts using an example which I give generally in such conversations, that when we talk about innovation and things being incremental, which is very, very true. So when I was a MBBS student at Sion Hospital about 10 years ago, I had my girlfriend at that time, wife. Now she had a iPod
You
Touch.
have to clarify, the girlfriend at that time, wife now.
Obviously, not lucky like Bharat sir. So I had her iPod Touch, and that iPod Touch could essentially do everything that my phone can do today, except make phone calls, right? WhatsApp didn't exist back then, but it could do Orkut. I could literally from the outside of my jeans pocket change songs. I had Bluetooth headphones. I could do everything that we can do with a mobile phone today, 10 years ago. So I was just thinking to myself that, so what has changed for me? And actually nothing has changed for me, but it's changed for the rest of the world. Everyone now has that power. Everyone has that mobile phone. Everyone has, if you look at it, OnePlus 1 to OnePlus 7 Pro, what can the 7 Pro do that the 1 can't? It's all incremental, right? But every rickshaw puller, every auto guy, every person in our country now has the ability to own a smartphone. So that is the innovation. So the very fact that we can today even aim to do an MRI scan at 2,500 rupees, 2,000 rupees, and still, in some strange way, people can make money off of that. It's a great deal.
So it's Uberization, democratization.
Democratization, correct.
And all of that technology enabling millions. You have a point of view.
Just a corollary. In fact, I'm a little disappointed with the panel.
Right, at the panel.
Yeah. I didn't hear a single technology company saying that we are a country of so many billions.
Sorry?
We are such a big populous country. There's a ground that we might have to do R&D which is India specific. A company comes and makes a ultra-modern scanner available for less than 1 CR. And in 4 years, there are 1,000 footprints in India. Why doesn't one of you come out and say that we'll make a 16, 18, whatever, 36 size scanner, which will run on batteries, which will run on Wi-Fi, which can be remotely connected. We'll price it under 70 lakhs, and maybe we'll have 5,000 installations across tier 2 and tier 3 cities. Wouldn't that be the real innovation?
Can I?
Yeah, that's precisely what I was saying.
Okay, let Anupam. So Anupam works with Neusoft. And
I'm Anupam Agarwal. I am having Neusoft medical systems operations in India. Sir, just to address your statement just now, we promise you that Neusoft being a multinational, having 5th rank globally in radiology, we have more or less developed a system, 16 slides, which will be rolling out in the beginning of the next year, and which has been designed for the Indian market, and this will cost less than 1 crore rupees. And this is going to be the latest, and I can promise you, definitely this will meet all your expectations.
So I wish Ratish was here, because Sandra's come out with a machine that's what you're saying. It's not battery operated, it still needs electricity. But beyond that, it's again an extremely sub-broad price 16 slice scanner that they've done. So people are doing stuff, but I think it takes time to get, our country, irrespective of the made in India and apparently things being better for businesses, it's not that better for businesses. It's still it's easier to import than build in this country.
Can I add something? Yeah. So, our problem basically has been is that products are being pushed at us. They've never been made for us.
That's right. Exactly.
So I'll put out, since there are X-ray companies who are sitting out here, I have a simple question for you. Your DR, the lowest one comes at what? 60 kilowatts, 80 kilowatts, 100 kilowatts? Who needs 100 kilowatts on an X-ray machine, for God's sake, today, which is a standalone X-ray machine? I am not going to make a repeat exposure. Why do I need it? I have that brilliant digital panel which is sitting out there, which doesn't need that blast of energy. And hence, I can actually have the same product running on a much lower rated equipment. Who needs 7 Tesla scanners?
Exactly.
We don't even know what we needed.
The issue
is
is
community.
So
What does the community need? Yeah.
We have a question.
Sure.
Probably answering your question as well.
Hello everybody, myself Consort from Nanavati Super Specialty Hospital, Mumbai. I have a question to the panel that in today's era, one of the most major problem in radiology is waiting time in MRI. So I have a question to all the companies that in MRI we do the sequences like T2, T1, flares, there are many sequences. Rather than going to the sequences, do you have an idea we should run only one sequence and later on reconstruction possible?
Okay. Can we hold on to the question, because right now we were discussing the 180 kilowatt question. I thought you were going to add to that, but we'll come back to your question. Can we? Yeah.
So we have tied up with Scanray with a 2.6 kilowatt mobile X-ray with our DR. And I was also thinking the same way which you were thinking, that we have a very good detector which can detect. Every time I go to a hospital, they say, no, I want a 32 kilowatt only, a mobile X-ray only. And sorry to say that we are not been able to sell more than 20 machines in the last 4 or 5 years. So we failed miserably. We tried the same, but there is some of the friends of mine and yours are saying that no, we want only 32.
I'll ask you
Our
one
credibility is
question.
at stake
Before
here.
the-
Our credibility is at stake.
Before you go on, I'll just ask you one question. No one ever talked to you about how many kilowatt machine. Each one only asks you how many MA machine. Correct? So we are still counting MAs,
60 MA.
without looking at kilowatts, which is a user who doesn't know what he wants. And he's still going on because there had to be 1,000 MA machine in the department if you want to brag.
And that's our way to be blamed if the user is ignored.
I'm not blaming them. I'm certainly not blaming
But
them.
I think the
Telling
point
them
is
I'm
more managerial than anything else. And we, as I said, our dilemma is our credibility. You talk about 1,000 units, 3,000 units, you put $3 million or $10 million into the investments, and suddenly the output is not what you expect. So obviously, and as I said, the reason is that India is going to be probably not, let's say it's a controversial statement, but not going to be as innovative as US because the market is big. That's the only reason. We can be very innovative. But where is the market? The market is differently managed. Now, I think we should discuss this topic of price control. The pricing authority. I mean, those kind of things doesn't make India a very popular destination for any investments also. So look at that, and I also discussed
We
with
had
you.
that last year as well. We had, I forget his name. Do you remember the one who came to the panel on Big Brother? Sinha. Mr. Sinha had come and he told us categorically that in 3 months all of you will not be able to charge more than 2,500 for an MR. And and everybody here had this really long face as well. But I guess that's
Dr.
still a
Bhavin,
long
just want to interject. Yesterday, Dr. Indu Bhushan was here, and to this point, to what the captains of the industry, in terms of the CEOs of the private healthcare sector, hospitals were saying, they were complaining about the package rates in Ayushman Bharat being so low. So he said very clearly that his dream, the Ayushman Bharat scheme is built on the philosophy of moving from high value, low volume to the reverse. So I think the discussion here will have to go that way, and to your point that there is no innovation in India. There are innovations in India, it's just that the innovations are not the paying ones. So we'll have to, if those same innovations can pay their way, or someone's there in America, it's paid for, here it's out of pocket. So we have to find someone who will pay for that, then automatically the innovations pay for themselves down the line.
So, for the audience, Viveka Roy Chaudhary is the editor-in-chief of Express Healthcare and Express Magazine, and somebody you must listen to whenever you get the time, and of course read her editorials as well. So the point here, I think that you all are also trying to make is that if you have price control on services, eventually you have a price control on the machines as well. And the plan, of course, is that Philips, for example, won't be able to sell a 3 Tesla MR for more than 7 crores or 5 crores. That's a cap. And then the company has to decide whether they want to continue doing that or not doing that, the way it's happened with stents and stuff like that. So if that's the big thing that we're looking at, rather than any tech innovation, then that's something that's going to change the way that we're going to be interacting.
So one of the things that I would want to highlight is, with everything, it comes technology at what price, right? And that's where we are also looking very closely. If we are giving a technology which is cost, but at the same time we would want you to bring in more remuneration as well. And that's where you mentioned compressed sense, right? And we have had centers where if they were doing 30, they could increase by another 10 patients. And that's a long-term investment as well. So rather than looking at a cost which is one time, but if you look at the entire investment in the span of it, yes, and that's the focus for us as well as in India, where we are looking in bringing technologies which are very relevant. Be it 16-slice CT, which if I say 3 years back, we never had that. We never had that in our portfolio. But we looked at India market and these emerging markets in last 2-3 years. We have brought multiple, in CT, in MR, we brought Prodiva last year. Then even in ultrasound, humongous range of innovations which we are trying to get in market, and that's where we as technology partners, we do not want to compromise on the technology bit of it. But price is something which we understand it's quite sensitive in India.
Yeah, and on top of it is price control. I come back to the same topic. Now, you have a price sensitive already, because we are the lowest price country, not from the device perspective. The patient pays lowest amongst the world in any case, whosoever pays. And now on top of it, we have price control pressure, which basically makes the whole innovation resistant country in any case. It's not attractive anymore. Even though the volumes can make it attractive, but the problem is the price-volume ratio has to be market-driven, not regulatory-driven. And that's the bigger issue we have. Let it be market, let market drive, let me compete in the market, you see a better value product.
So we're becoming a country of AI developers on the software front, where labor is cheap and we're able to drive in products. I don't know if Amit wants to add anything to this.
Bhavin, actually I'll answer the question that you asked me at the onset. What do I see that big thing happening in the next 5 years? The big thing that we are going to see happening in the next 5 years is we will have the performance of today's equipment at a fraction of the cost. And that is going to be the big innovation. We do not need fancy stuff. The community needs certain kind of equipment. Innovation does not mean the biggest and the baddest and the most advanced and the most phenomenal and the powerful and obviously the most expensive equipment. It is an equipment for the requirement, what the country needs.
So,
and this
Rankin, you agree to this?
This Rankin is a professor in MRI with last 35 years who put out the statistics on how many 3 Teslas are running in US and how many are running in China. And he says in China, the scanners which do the job that they are supposed to do. They take care of 95% of the requirements of the community and pass 5% out to those scanners, which are the big and the bad ones. And that's what we need at a cost, and not for India.
So
Even US.
okay. So when you all talk about the integrated thing that you are going to do 5 years from now, is that part of this vision? Is that how it works?
Sir,
Can you let it?
yeah. Basically, I want to say that.
Can you please let her answer? Thank you.
Yes, I agree to his point, and also I just want to add in this, if we can have a Make in India approach, so then we can have the price control and everything.
Are you all doing any Make in India stuff?
Yes, we are. We are planning that.
But not as yet. What are you going to do as far as Make in India is concerned?
We are planning to invest in some of the some of the companies, and also take over some companies, and even export the products from India, improve the quality of those products.
But buy out existing companies.
Yeah, especially buying out the existing companies.
Is that a strategy, Manali, that you're on?
Yeah, basically to also make some reverse innovation, we call it, basically. The Make in India products to the African countries, Middle East, South Asian countries.
Okay.
So we are planning to do that. And also my feeling is that whatever we are criticizing for the Ayushman Bharat, and also I say that that's going to put an additional people being able to take the services. Those 50 crore people who are today not able to take those services. So that will open a plethora of
I think that's what Mr. Sinha was saying last time.
Yeah, so that is going to open. And I talked to Dr. Bhavin yesterday, and he was telling me that they have a plan for 150,000 wellness centers. And out of that, 10% will be done in 1 year, then 15%, 20%, 25% like that they will grow. So my feeling is that
they have 5 years.
Yeah, 5 years. So in 5 years they are going to complete that work. And it's going to give an enormous kind of volume. And I'm really thinking that if we can innovate certain things which are at price points, especially and with the public-private partnerships, this is going to be a big opportunity for all of us.
So what is your strategy?
So we are making India, not yet definitely, but we are getting there probably. But yes, taking over other companies, because right now we are also going through the phase of seeing what we can innovate for a country like India. All these years it would be US, it would be mostly China that would take over all the innovation. But Carestream is focusing on what we can do differently for India. We have been looking at the different options that we have for X-ray, for the other things. So we are going there. It takes its time, but we are definitely maybe thinking of taking over.
And Anupam, what does Neusoft think? I mean, it's a Chinese company, so where does it fit into the scheme of?
So actually, Neusoft is a Microsoft. It is like Microsoft of China. We are a software company, and if we talk about the Indian market, by the introduction of 5G, we are focusing that how we can make the facility available at the primary level. The transportation of the images can be faster. It can help clinicians to send the report back. Because at this moment, what is happening, the kind of PPP, on PPP model, machines are being installed at different locations. Even quality technicians are not available. Radiologists are already in less numbers. So, problem is that reporting is delayed by 2 days, 3 days. So, if the same can be done same day, we need to use the technology and.
So you all will empower. You will use technology to empower setups, especially in restrict places, to be able to deliver the reports and stuff like that in time. So to go back to that one question, just come back to that he had about, can't in MRI be like with CT scan, right? Have one sequence that you do, and in that sequence you get T1, T2 diffusion, spectroscopy, and everything. That's your wish list. You're not a doctor, right? Are you a radiologist?
No, sir.
You're in the management service.
Yes.
Yes. So as a manager, your wish is that you put the patient in like with the CT in 2 minutes, the MR is done, and you get everything out. So
Also, we have Magic in GE, which we did not find really very useful. So they are trying to do that, but I think it's some more time for it.
But I think managerial wish lists are managerial wish lists.
You have everyone who's working on the same
I
way.
was
So the
hoping-
Siemens fingerprinting is going the same way. That you are reaching the synthetic.
Harsh,
Back there.
So we are trying out one sequence. I'm not at liberty to say who for. It's on the 3 Tesla, 4 millimeter slice thickness, 0 gap through the entire brain, 1 minute 15 seconds. Once one acquisition, you get a T1, you get a T2, you get a flare, you get a GRE, you get a diffusion, and you get an ADC map. So this is 1 minute 15 seconds. It's under trial. It's not available commercially. It's as part of research.
You've signed an NDA. You can't.
We've signed an NDA, but this is already there. It's working phenomenally.
All right, great. So you'll get your wish list. I think what Nanavati Super Speciality needs to do is figure out where and with whom Dr. Mahajan is working, and then do your same NDA based thing. We come back to Viveka. You had a point of view.
I just had a point. As a journalist, you talk on one hand and then the other hand. So to my previous point of saying that it's going to become high volume, low cost. Dr. Ajay of HCG in his presentation made the point yesterday that what is the cost of low cost. So that's also what we need to keep in mind. And I know that, to you all it will be music to the ears, because then it's an immediate counter argument when the government asks you to lower your price. You say, okay, when I'm going to lower my cost, I am going to lose out on quality. So what is the cost of low cost?
That's a good
Healthcare,
phrase.
you can't do that.
That's a lovely phrase. So what's the cost
Dr.
of
Ajay
low
of
cost?
HCG, not mine.
Yeah, well, that's fine. You can popularize it, and so that's done as well. Anybody in the audience, any quick thoughts on where we will be 5 years from now from a tech perspective? From, as it looks like it's not going to be tech in terms of some big whiz invention. We're all looking at, we even reached a stage where we're saying that everything, including AI, is only going to be an enabler to allow us to do high volume business at a lower cost than today. And obviously the companies are a little running scared, because if that's the case, then but supposedly high quality. And that's where we are. Yes.
My name is Rohit and I work with Philips, and I have a personal small quick thing to share with you. I come from an Air Force school in Delhi, and all throughout I loved fighter planes, and I happened to sit across the pilot at some point of time. I asked him which is a better plane, a Russian or an American. Because as Indians we've always been dependent on Russian planes, which are the big fighters. He said technology, those guys are brilliant. You can fly them anytime, they can work on the Siberian desert, they're beautiful. But the fact is when you have to fight, the control button is near your knee, where you have to shoot. The missile button is near the foot pedal. It becomes very, very difficult. If you look at the American plane, on the other hand, they put the pilot and they design the plane around him. So as an organization today, Philips is an organization where we are thinking of designing things and solutions for you. Now, to answer your questions, is it just going to be software, solutions? The answer is no. What are you looking at today? You're looking at lowering the cost of healthcare. Now, what are the big innovations which are coming today in healthcare? The first part is, real estate is expensive. Today we're talking about the fact that MR is expensive. But let me just counter that question for you. Can I give you an MR less than 1 crore? Yes, I can. But if I give you 1 crore MR where you have to spend about 4 crores for a real estate place, it costs you 5 crores. What if I give you an MR which is a very small footprint, which I did in case of Dr. Mahajan? It could move through a small gantry. You can move it to the 4th floor, you can move it to the 5th floor. Typically when you're opening new wings for MR, why? Because the machines are damn heavy. And why are they heavy? Because they contain about 1500 liters of helium. Today we have an MR which uses 7 liters of helium, which is a scarce commodity by the way, which is made only in America, Algeria, or probably Qatar. We're using 7 liters of helium, making the machine 900 kilograms lower weight. Now you can take it to the 4th floor. Imagine big hospital setups in Bombay, real estate is an issue. You already have a center. Now you can construct a place in the top lab. Do we have that? Yes, technology will be made for you. We will try and create a plane for you. So the innovation demands that we have to create a product which is smaller in size, we do that. If the innovation demands we reduce the cost of healthcare, we do that. If the innovation demands that we reduce helium completely because that's not going to be available a couple of years down the line, we'll do that. If the innovation demands that we just give you financial help or create a hospital for you or design center for you, that is what the company is willing to do. Because ultimately everybody sitting here, whether it's me or my competitors here, are working on 4 aims. Quadruple aim, either improve patient experience, either you're improving your staff experience, you're lowering the cost of healthcare and better outcomes. I can't think of any other. And that's all I'll say. I think we are healthily committed. All of us are making that effort to answer the questions of India. We set up a huge center. We have close to about 8,000 people working on software. In terms of equipment, we're setting up a big, in fact, we set up a big CT unit, and you should be seeing the first couple of CT devices coming from India as well. We already have a very flourishing IGT business where we are the market leaders. Again, made in India, by Indians, for the world.
Great, thank you. So on that note, I think you've summarized in a way. So of course, you pushed Philips big time, but nevertheless, point well taken.
Sold Philips. This was not told to us. We should have sold a company, no?
So point well taken, and I think in the end, therefore, we're looking at innovation to drive down cost, as Uday says, and trying to maintain the same quality and high volume. So with that, we thank all of you for being on the panel. Thank you, audience, and thank you everybody else, and thank you.
I'm all set to request the panel to